Welcome to the Tarrant County Medical Minute podcast.
All right, welcome to the Tarrant County Medical Minute podcast. My name is Dr. Omar Selod. I'll be your co-host for this episode. I'm the president of the Tarrant County Medical Society currently, and with me is Brian Swift. Brian is the EVP of the Tarrant County Medical Society. So
I'm happy to be here. And we've been talking about this podcast, or starting the podcast now for some time.
Right. No, I think it's great because traditionally we've been going through print media to communicate with membership, new members. We've got a lot of younger physicians in training, new physicians in town that I think use social media maybe quite a bit. So I'm hopeful we can reach them.
I'm fired up about it. I mean, I'm talking to students. As we know, we all work a lot with students, our residents.
Right.
All of our physicians are at a different stage in their career. We have a lot of physicians that are on the younger side, some that are mid-career, and those that are getting ready to retire. And I think this really appeals to everyone because we are all interested in, and that's what we do here at the Medical Society, is we advocate for physicians and patients. And that's what an advocacy organization is all about. So we want to be able to, as you mentioned, be able to reach out to those older people that are having, used to having a print magazine or a news flash or those sorts of things. And then, of course, our young new physicians out there. And the only way they communicate is on social media.
Right. And we're not getting rid of print either. We're just adding to how we communicate with our membership. So let me ask you a question. What's your journey? What brought you? When did you start with the Medical Society, and where'd you come from?
So I am from originally Upper Michigan. Came from a small town, and I was not a student, unlike you. Believe it or not, I wanted to become a doctor. And however, I had this problem in school where I got C's and D's. So I quickly figured out that medical school wasn't going to be the thing for me.
Might be tough to get in.
It might be a little bit tough. Exactly.
Yeah.
So I did end up going to school, and I took the easiest thing that I could find in college, and that was a psychology degree, just to get a degree. And I graduated, didn't know what I was going to do, and I happened to be out at the golf course playing golf, and I saw a man dressed in a suit. And I was like, why is a guy in a suit dressed at the golf club? And it happened to be my congressman. And I just went up to him. I said, hey, how you doing? Introduced myself, and 5 days later I got a call back, and he said, I want you to come to work for me. And I didn't know what a congressman was. I didn't know anything about politics. Next thing you know, I'm involved in politics, and that pretty much has been my whole career. I just happened to be doing healthcare politics here at the Medical Society for 14 years now. And then prior to that, I worked for the American Medical Association, but mainly it was working for politicians, governors and congressmen and things like that. And I did spend 1 year in Iraq, which was really an interesting story. We can talk about Iraq stories at some point. But totally opposite from you. So for me, as a non-student, I was always interested in science. I mean, what about your journey? How did you ever...
So both of my parents are physicians. Dad passed away in 2020. Mom's alive. Both were doctors practicing here in Tarrant County for many years. So I tell everybody it's kind of in the blood. You grow up around physicians. All their friends were over at the house, physicians. Medicine was constantly at the dinner table. And so I'm not sure if I really knew what else I was going to do besides medicine. I just kind of grew up following my dad at all the hospitals, rounding with him when I was a kid. And, when I was growing up, he's like, Omar, what do you want to do? I think you should be a physician. There's a lot of great perks to it, being your own boss, in control of your own destiny and all that sort of stuff, helping patients along the way. So one thing led to another. I applied to medical school, got into medical school in Kansas City. I only got into one medical school, but that's okay. You just need one person to give you a shot in our field. Got through, came back to, grew up in Fort Worth, so came back to the Metroplex. Did my residency at Dallas, started practice here in Fort Worth. Have been here since 2001 in practice. So joined the Medical Society early, saw all the amazing benefits of it, in terms of networking and, just learning from peers that were a little bit older, kind of teaching the ropes of, when you're in residency, you learn the medicine side of everything.
Right.
But there's another side of medicine that you just are not aware of until you graduate. The business side of medicine. How do you keep a private practice afloat? All the issues that you hear about in the background when you're training that are, legislation and all that stuff that's going to affect your career. Me personally, I was not paying as much attention to it until I got involved with the Medical Society. And then I was like, oh my gosh, this is great. This is great for us physicians. So over the years, got more involved, met you along the way, right. Met your team along the way. You guys kind of helped rope me in a little bit. And honestly, it's been very rewarding. So thank you guys for all that, I will say.
Well, I'll tell you, I've been amazed. I've always said, and again, I'm partial probably to Fort Worth. When I was at the AMA, I was a liaison to the states, so the state medical societies. Okay. And I had about 15, 16 states that I covered, and Texas was one of them. So I got to know the Texas physicians. And what happened was when this opportunity came up here, they had asked me, hey, would you think about coming to Texas? And, I'm like, yeah, I think I'll give it a shot. And it was, again, one of the best decisions that I made. I love Fort Worth. It was a move to come from Chicago. My family's still in Wisconsin, but I get back often. But I really love Fort Worth, and I think I love Fort Worth because of the community we have here of physicians that do so much for the community. I don't think people realize, and we're going to talk about this another time, but we created one of our signature projects called Project Access, and we can get into that another time. But one of the things I saw when we created that program was that physicians give of their time and energy, want nothing other than to help, give a helping hand to somebody. And it doesn't involve money, it doesn't involve anything other than compassion. And we've got such a great group of Tarrant County physicians that get together here at the Medical Society, as you say, network, but also do a lot of projects here in town that benefit patients.
Yeah.
And I think you can attest to that with your practice, right?
Yeah. Oh,
and I'd like to hear more about that practice, because I think a lot of the medical students that I talk to and residents, I've kind of seen it change, that a lot of people only think the only opportunity to practice medicine these days is to go to work for a hospital or go to work for a large group. Right. You've kind of taken a different path, right?
Right. So, I'm in private practice right now, as you know. I'm in a group of 6 physicians. Private practice. One thing I love about Fort Worth is private practice is still thriving in our city and in our county. And I feel like now that I can kind of look back, I've been in practice for 22, 23 years now. And in large part, it's thanks to you all in the Medical Society in, really helping us form relationships, because private practice physicians do lean on private practice physicians. And it's wonderful because I get to practice medicine the way I want, where I want, how I want. There's nothing wrong with, being an employed physician as well. We actually work with them all the time. We all work with each other, to each his own. But, through the Medical Society, you don't feel like you're alone on an island. You feel like, hey, there's other groups, other physicians that are out there fighting your battles with you to survive, because it's getting tough. The way healthcare has become, with reimbursements and rising costs and, all the little, referral processes and all the other things you need to do. It's costly, EMR systems and all that sort of stuff. But for us to be able to bond together, you feel like you're on one big team.
Right.
And honestly, it's the Tarrant County Medical Society that I realize has been able to help connect me and leverage me. I've met so many people. I lean on them for ideas because look, a physician once told me in training, it's one of the best pieces of advice that I ever had was a good doctor knows what he knows and knows what he does not know.
Right.
And when you're in private practice and when you're a new physician starting, you're going to make mistakes, business-wise, medicine-wise as well. And you have to learn from your mistakes. You have to learn from your colleagues. Everybody's here for you. So, private practice has been great. Fort Worth's a great city to practice. Tarrant County is a great county to practice this, and the medical society helps us. So, we can get into all the nuances of it and all get into the weeds later on and other stuff. But, when you hang around people that can teach you, that's invaluable. And so that's the one thing I've learned is, listen to the elder statesmen that have come through, and I've met them through the society. And now I'm kind of probably mid-career, and now there's younger people, and I'm just helping pass it down. So It's been fantastic.
Yeah, and that keeps me fired up.
We need it,
right?
We need you all.
So people ask, well, how many physicians belong? What makes up the medical society here in Tarrant? And so we have about 2,000 active physicians, practicing physicians. We've got about 1,000 students. As you know, we're very active at UNT and with the new MD school at TCU.
Right.
We just had 2 events, right? The welcome events. Right. Isn't it awesome to see the excitement of the new medical students come in?
That was one of the most fun things, I think, as the president of the medical society, is getting to speak to the incoming classes. You look back and you remember yourself, week 1 and how overwhelmed you felt. I don't think I went to my school or our medical society meeting, but of course that was back in the day. So when I went to the UNT one and the TCU one, it's motivating for me to see young kids coming through, and they're going to be coming through clinic one day, and I talked to them, and I've already had, that was like 2 or 3 weeks ago, I've already had a couple of them come to office and shadow me. And so it's been fun. And I'm asking them, how are you adapting to the city and all that sort of stuff? So you kind of feel like you're taking them under your wings,
right,
and providing that little, hey, I'm here for you if you need something, because you're going to have ups and downs. And I'll tell you something funny. My middle daughter started medical school down in San Antonio, and she said, hey, Dad, they have a medical society meeting. And I said, you're going to that? You will benefit from it. And she went to it, and she called me, and she said, Dad, it was awesome. I met so many people, and they took my number, and I might be helping out on some stuff. And I'm like, you know what? This is what you have to do.
Right.
This is part of your profession as well. It's not just seeing patients. It's also learning how to be an advocate for them outside of the clinic and that. And so I get it now.
Right.
I get it a lot better now that I've been involved, and I encourage everybody, get involved with the medical society.
I've had that experience too, where we've had our events here over the past few weeks, and just students coming up, and they want to hear more about this or that.
Yeah.
And so like you say, it is very exciting. I think the students, I don't know, I've really seen a change. I think students are more engaged.
I agree with you. I agree. They're much more dynamic, more engaged. They listen really well. You just feel their energy, and they want to make changes. There's a lot in our industry that needs to be fixed.
And the young generations are the one that is going to fix our broken healthcare, right?
Yes.
Everybody talks about the system is broken.
Yeah.
And that's really what advocacy is all about. That's what we do.
Right.
So, whether it's scope of practice bills or tort reform. Texas is a great place to practice medicine. But those hard-fought battles were not won, right? Sitting on the sidelines, letting the other person go down and talk to their state legislators or talk to their Congress people. It takes engaging and getting off the couch, even if you commit to one meeting or one first Tuesday is one of our advocacy. And we've got a legislative session that is going to be coming up next year. And we've got a lot of things on the table. And so whether it's scope of practice, I mean, think about your practice when you just an issue right now, pre-authorization, right? How many hours do you spend on people that are non-physicians telling you about what you can and can't order?
Just the other day, I had an amputee. He's lost both of his arms from a burn injury. And, we order a home health aid for him and get his prosthesis repaired. And he needs all these things. He can't use his arms. He relies on prosthesis. Every time I've got to go to this pre-auth, I've got to call somebody I have to explain to him the obvious why we need this care for our patient. This is wasting my time, taking away my time away from patients. I'm having to pay staff to help kind of do this. And this is the obvious and all this stuff. I mean, it's about who's suffering, not me, my patient, who's waiting for approval for an aid that he absolutely needs. And so it's just sometimes you just like, why are we having to deal with this? We can make the system better. We can make it more efficient. And the patient is the one that really needs this. And so, but it's us physicians that need to, kind of lead the way here. I know we've tried, and sometimes, it's not our fault that we're having these issues, but it doesn't really matter. We've got to keep fighting for our patients. We have to fight for our profession. And so, I've learned a lot. Like you brought up tort reform. When I first started practice, that was like the big topic. And I just had come to Fort Worth setting up private practice. And I remember Tarrant County Medical Society physicians, and I specifically remember Dr. Joe Todd, an orthopedic surgeon, coming to the office, bringing pins for our white coat, all that stuff, yard signs and this and that. And I'm not sure, I was a young doctor. I'm not sure I really had the foresight of how that would impact me for years. But, thanks to him and all those that worked with him and fought and got us tort reform, I get to practice medicine in a much more practical way today because I'm not so worried about lawsuits like my father, who was a physician prior to me, was constantly playing defensive medicine. I can practice medicine, And so, these are the things that, those that have come before us have done. And now I realize, hey, our medical society is fighting for us. And it's important for all our young doctors to get involved too. I'm glad I got involved at a young age. Join the society is important. So,
and it's hard work, right? Politics is very hard work. And I mean, you'd love to be able to snap your fingers. I mean, how a bill becomes a law, right? It sounds like really a simple thing, right? You should be able to, look, we've got this little problem, and we should be able to agree, because most of the time people, if they talk to one another, they probably agree on 90% of the things. But that is the disdain of politics, is that politics are played on both sides. And then the simplest things that should be easy to solve become entangled in all these bills and this back and forth. And again, this is part of why we're here, is to educate our legislators, to go there and talk about why it's not a good idea for medicine to be turned over to people, for example, that did not go to medical school. That is one of our big things, scope of practice. We all agree, right? There are so many great people out there, nurses and PAs and people that support the medicine. But it takes a team. And if we're going to encourage our young people, our young physicians to continue to go to medical school and put in that time, we're not going to be able to farm those things out to people that don't have the knowledge, right? Everybody wants the best care. And so you've got to be able to have those people with the schooling, with the hours that you put in residency alone, right? After medical school, right? How many procedures, how much time did you put in? And from a patient standpoint, you want that, right?
Right. Well, the more we can get everybody engaged, the better chance we have to be able to practice medicine the way we were trained to and want to. Well, I think we're out of time here, so
we have so many topics.
We have a lot of topics.
We've been fired up to get this first one off the books, and as we're talking, I'm thinking about all these things
all these other
I
things
want to get out.
Yeah, there's a lot.
Right,
there's a lot.
But I think this might be a good place to end it. Hopefully, we've at least got a few people that might be interested. We can get more into our goofy side. And some of our, we can start talking football
Cowboys
trash,
versus Packers.
Right? Cowboy versus Packers. We own you guys, by the way.
I can't argue right now, but we're coming back this year. All
right.
But if people can follow our social media sites, get more engagement, we can make a difference.
And and what we want to do, right? We want to mix it up. We want to have a lot of guests. We want to have medical students, residents. We've got a whole lineup, actually, of people that are already asking. And so we encourage people to like us, and we encourage people to reach out to me here at the Medical Society, Brian Swift. And, we're happy to get you involved, and let's really get this thing going. I think we got a great opportunity here.
We will. All right.
Awesome.
All right. Thank you all.